Hey everyone, and welcome. Today, we're going to break down the essentials of anxiety disorders. We're going to use our source material to build a really clear and simple guide to this super important topic.
So, here's our game plan. We'll kick things off with what anxiety disorders actually are. Then we'll look at the different kinds and the symptoms to watch out for. After that, we'll cover how it's treated and wrap it all up with a key final message.
All right, let's jump right in. First section, what exactly are anxiety disorders? Let's take a look at the official definition and figure out what separates them from the kind of everyday worry we all feel from time to time.
You know, this is really the fundamental question we have to answer first. It's not about if you feel anxious, but it's about the intensity, how long it lasts, and, probably most importantly, the kind of impact it's having on your day-to-day life.
So here it is, the crucial point. It's when that feeling of fear or anxiety becomes excessive. It feels way out of proportion to the actual situation, and it starts getting in the way of things. Your job, your school, your relationships. That's the line between normal worry and a disorder.
Okay, so it's super important to know that anxiety isn't just one single thing. It's not a one-size-fits-all condition. It actually shows up in a whole bunch of different forms, and each one has its own unique features. Let's start with two of the most well-known types. With GAD, or generalized anxiety disorder, it's like this constant, low-level hum of excessive worry about, well, all sorts of everyday things. Panic disorder, on the other hand, is totally different. It involves these sudden, really intense episodes of fear, panic attacks, that come with some very real, very scary physical symptoms. Now, let's look at anxieties that are tied to specific triggers. A specific phobia is that intense, overwhelming fear of one particular thing, like heights or spiders. Social anxiety is kind of similar, but the trigger is other people. It's driven by this deep fear of being judged or embarrassing yourself in social situations. It's also really important to get this sometimes. Anxiety symptoms aren't the root problem at all. They can actually be a direct result of using or stopping certain substances, or they can even be a symptom of a totally separate physical health condition.
In this chart does a brilliant job of showing the critical difference between two trauma-related disorders. See, they both stem from a traumatic event, but the diagnosis all comes down to the calendar. If the symptoms last for less than a month, it's acute stress disorder. If they stick around for more than a month, that's when it's considered PTSD. The timeline is everything.
Okay, so now that we know about the different types, what are some of the common threads that run through them? Let's talk about the key symptoms, both in your head and in your body, that are good to be aware of. Right, these are some of the heavy hitters, and what's really interesting is how they affect both your mind and your body. You've got the mental side, right? Like that nonstop worrying or finding it impossible to concentrate. And then you've got the physical stuff, like tense muscles, a heart that feels like it's going to beat out of your chest, or just not being able to sleep.
All right, this might just be the most important part of this whole explainer. The big takeaway here is that help is absolutely available and the treatments really do work. So let's dive into the proven ways to get better.
The best way to tackle this is with a comprehensive approach. It doesn't just rely on one single thing. Instead, it usually combines three main areas that all work together to get the best possible result.
So think of it like a three-legged stool. You've got psychotherapy, medication, and then lifestyle changes. All three work together to create a really stable support system. Let's break them down one by one, starting with psychotherapy.
So when it comes to therapy, a couple of methods really stand out. Cognitive behavioral therapy, or CBT, is basically the gold standard. It helps you learn to recognize and change those negative thought patterns that fuel the anxiety. And for phobias, exposure therapy is incredibly powerful. It's all about safely and gradually facing the thing you're afraid of until it loses its power.
Now moving on to medication. What's really cool here is that there's a whole toolkit of options. Antidepressants are often the first thing doctors try for long-term control. Benzodiazepines, they give you quick, short-term relief, but they come with a big warning label about dependency. And then you have other options, like non-addictive medications, or even beta blockers, which are awesome for just managing the physical symptoms, like that pounding heart.
And finally, we have that third pillar, all the things you can do for yourself. These are incredibly powerful non-medical strategies that build a strong foundation for managing anxiety. Stuff like relaxation techniques, regular exercise, and really paying attention to your sleep and what you eat, it can make a world of difference. So, we've covered a lot of ground here.
from the definitions to the symptoms to the treatments. But if there's one single most important thing to take away from all of this, what would it be?
This is it. This is the core message. These conditions are so common, they are not a weakness or a personal failing, and they are absolutely treatable. Just learning about them, just doing what you're doing right now, is the first and most powerful step you can take, either for yourself or for someone you care about.
And we'll leave you with this final thought. It doesn't have to be a giant leap. It could be learning a bit more, reaching out to a friend, making a call to a professional, or even just taking 5 minutes for some deep breaths. So what's one small step you can take today? Because honestly, sometimes that first small step makes all the difference in the world.